All right, we are hearing about this more and more. The U.S. CDC is tracking a new COVID-19 variant. This variant has multiple genetic differences from previous versions of the virus.
Yeah, there's a claim gaining ground on social media that says vaccinated people could be more at risk of catching this variant. So we went to the experts to find out the truth. Chris Costa verifies.
With COVID-19 cases climbing again and kids going back to school, concerns about a new variant, BA 2.86, are floating around. This social media post claims the CDC has stated Americans who have received mRNA COVID vaccines are now at a higher risk of infection from new variants of the virus than those who are unvaccinated. This post has more than 10,000 reposts and more than 25,000 likes. So, did the CDC really say this? And is it true? Let's verify. Are people who got mRNA COVID-19 vaccines at a higher risk of infection from new variants than those who are unvaccinated? Our sources are the US CDC and Dr. James Jarvis, Senior Physician Executive for Northern Light Health.
So it's not that they're getting infected at a rate higher than people who are unvaccinated or that they're getting sicker than people who are unvaccinated. That is absolutely not true.
Both Pfizer and Moderna shots are mRNA vaccines. This report from the CDC never states that people who got one of those shots are now at a higher risk for catching the BA.286 variant than those who are not vaccinated. The report does say there's no evidence yet that this variant is causing more severe illness. It says the current rise in cases and hospitalizations in the U.S. are likely coming from Omicron variants like XBB, not this new variant. So we can verify this post is false. No, the CDC did not say that people who got mRNA vaccines are at higher risk for infection from new variants compared to those who are unvaccinated.
Now, the CDC says an updated COVID-19 vaccine will be available in mid-September. It says current evidence shows this updated version will be effective in reducing severe disease and hospitalization against this variant.
It also expects existing tests and medications like Paxlovid to be effective with this variant.